Welcome, everyone, to the Asian Voices Radio podcast, where you'll find real Asian American conversations about all things, including the topics you were too afraid to ask your Asian parents. I'm your host, Hula Ramos, and today we're bringing back a guest who was featured on episode 18 of Asian Voices Radio podcast called Uncovering COVID-19 with Dr. Paul Y. Song. Just as a reminder, Dr. Paul Y. Song is a physician, progressive activist, and biotech chief medical officer. Please welcome back Dr. Paul Y. Song to the show. How are you doing, Dr. Song?
Great to be back, staying healthy and trying to stay clear of the virus.
No, absolutely. There is a lot of things that have happened since we last talked. As a matter of fact, as you know, probably, there is a spike in new COVID-19 cases since the 4th of July holiday. But let's even rewind a little further back. So, here in California, June 15th was that magical date where Governor Newsom said, you know what, we are opening up California again and we are allowing people to not wear masks anymore. Was there a reason that date was significant?
Well, unfortunately, around the time we had great numbers. Hospital admissions were down and everything. But what I think the governor and others did not anticipate was how quickly the Delta variant of the virus would start to spread. So, in June 15th, you started to see more people getting together. Bars and restaurants were fully reopened. People were going about their daily activity, and it really a lot of pent up demand to get out and be with friends. And unfortunately, there's still a proportion of our population that is either refused to be vaccinated or has not yet gotten the vaccine. And as a result, you can see this Delta variant really taking hold in those people that have not yet received the vaccination. I don't think there was any specific significance of June 15th per se, but I think you can start to see this dramatic exponential uptick of infection since then.
So then explain to those that really aren't in the know or just don't understand, because I know there are actually two variants. Am I correct? A Delta and a Lambda?
Correct. Well, actually, there are numerous variants. So the original variant that originated in China and was the first to start to infect people in mass quantities was the Alpha variant. And since then, when a new mutation arises, they are given subsequent names. So the Delta variant is believed to have risen in India, and that's the one that is now becoming prevalent throughout the world. But we now have another variant that has been spawned from the Delta variant called the Lambda variant, which some people believe is also equally, if not more, infectious. But because it has not yet been around and had a chance to really spread the way the Delta variant has, we just don't see the effect yet. But there are some experts I heard as recently as today that think the Lambda variant could actually be even worse than the Delta variant.
Oh my gosh. Not just when we thought we were turning the corner, apparently we took another route back to where we were before.
Well, fortunately, we're not quite there in the sense that a lot of people have been vaccinated, but unfortunately, those that have not are becoming a petri dish to not only get infected, but to allow the virus to mutate into a even more deadly or more infectious form. So that's kind of this whole idea of the herd immunity. We're all in this together. We're one big herd. But if
Mhm.
enough people don't do their part, the those that remain unvaccinated can not only get infected, but mutations can continue to develop within them and allow the further spread. And this can become a vicious cycle where it's like whack-a-mole, where just as we think we're getting the situation under control, the new mole or the new variant emerges and starts to infect more and more people. And that's really the danger right now.
Gotcha. Gotcha. So obviously for those, I guess to ask the question, the best way to try to rid of these variants is in essence getting vaccinated, correct?
Yes, I think absolutely vaccination is the biggest thing that each and every one of us can do. But I would also say for those of us that are vaccinated, that live at home with people that are not. So my wife and I have two young kids. They were not eligible for the vaccine yet. Um, we have not only taken our their health very seriously in terms of making sure they're masked everywhere. But even despite the fact that my wife and I have both been vaccinated, we try to avoid crowds and are always wearing masks when we're outside of the home. And that's, I think, what each and every one of us can continue to do.
Okay, so that also includes for those of us that are going back outside. Do you recommend we re-quarantine ourselves if after being out and about, vacationing, because a lot of people are going out due to it being summer?
No, I don't think we should go back to an isolationist lifestyle. I think particularly those that have been vaccinated should be able to go out and carry out as much normal activity as possible. The question is whether or not they should continue to wear a mask. And now more and more guidelines are coming out to suggest that we should be wearing a mask even if we are vaccinated. And the reason is uh, those that have been vaccinated are far less likely to end up with a serious infection, meaning requiring hospitalization or ventilation or something like that. But it's not impossible for those of us who've had the vaccine to become infected with the Delta variant or the Lambda variant, and then bring it back home and potentially spread it to our kids or those that have not been vaccinated. So while if you've had a vaccine, the likelihood of you dying from this or becoming seriously ill is much, much lower. If you look at the number of people that are hospitalized or have died from it's 99% of the people that are getting infected and having serious problems are those that have not had a vaccine. It doesn't mean that there could be a rare instance where one of us gets infected and then we can spread that to others. So for that reason, it's just better to be doubly cautious and wear a mask.
No, that's great. I was actually going to ask you that question about, those of us that are vaccinated, if we, should we have to worry about now having to get boosters or getting an additional, vaccination because of all these variants?
Well, it's a great question, and really it will depend on the type of vaccine that you received. Again, we're still accumulating data, and more research is being published each day. But it does appear that if you got the two-shot messenger RNA vaccines, meaning the one by Moderna or Pfizer, that you're much less likely to be infected or develop serious problems from the Delta variant. There has been mixed data with regard to the J&J, the one-shot vaccine, um, and the AstraZeneca vaccine. So I think that if you had the two-shot mRNA vaccine, most experts believe you do not need a booster shot. But if you had the single shot J&J vaccine, there is a chance that at some point you will be asked to come in and get a booster shot, and it may be not another J&J shot, but one of the mRNA vaccines where you would only receive one shot instead of two. But these are the things that people are studying right now.
So there's a lot of, these misnomers and a lot of these people that are, spreading false information. One of the things that I know that I actually have friends that are very leery about getting the vaccination because they say, well, I'm waiting for like the big vaccination to come. What would I say to those people? Like I keep telling them, just go get vaccinated. It's better to do it now than to sit here and wait for this all, inclusive vaccination you think is going to be happening. What are your thoughts on that?
Well, I will say that so far the data for the two-shot mRNA vaccines, again, the Moderna or the Pfizer vaccines, they seem to be almost a home run. Now, remember, there's never going to be a vaccine that's 100% effective,
Right.
but they've been shown to be very, very effective against all the variants up to now, including the Delta variant. So, for your friends that have been reluctant, I would say I don't think you'd get much better than that. And at the same time, particularly if your friends are in the less than 40-year-old age, sort of what we call the invincibles, they're the ones that think they're too healthy, they're not going to
Right.
succumb to this. All they have to do is look at the news recently and look at the number of young people who are in the ICU or who have died. unfortunately, in the last 2 months from COVID. And what's so sad about it is every single person who has died in the last 30 days, I would say the majority of them, if not all, it was preventable had they gotten the vaccine.
Wow. No, I agree with you 100%. Yeah. No, there's something though I've been interested in, and I mean, you hear these rumors and you hear these things, but so when I got vaccinated, for me, my first shot, I was pretty good. I honestly worked the next day and had no problem. But my second shot definitely kicked my butt. I was probably out for a good 3 days and did kind of develop some flu-like symptoms. Does that mean that had I gotten COVID, that I would have been in the group that would have been affected a little bit more? Or like I know a lot of people talk about that. Is that like something that is true?
They really don't have any data on that, but I would say the fact that you did have a reaction to your second shot means that your immune system was doing exactly what it was supposed to do. So after the first shot, it started to produce the antibodies, but when you got the second shot, it's almost like tricking your body into saying it has an infection, and it causes this upsurge of your antibodies and your T cells to really start to kick in. What we do know is that for those that did have a robust reaction to the vaccine, meaning they felt crummy, I hear people in their 20s that were knocked out. They couldn't get out of bed for a day or so after the vaccine. There is a belief that those people are going to have a stronger defense against a future exposure to COVID than those people that don't have it. If you look at older people, people like my mom's age or maybe your grandmother's age, many of them don't report having any effects whatsoever. And that's because as we age, our immune systems get weaker to begin with.
Mhm. So obviously, as we're recording this right now, the biggest story in the world is the fact that the Olympics is going on as we speak. And what are your thoughts, your professional opinion about the fact that, okay, we've decided to let's just move forward and go ahead and do the Olympics? Any thoughts about what's going on with that in regards to COVID?
Well, several things. One is that there have been some athletes that have tested positive early on and have been quarantined. I would say that it's probably one of the safest places to be right now because of the frequency of testing that every athlete and team member and has to do. There is also no spectators allowed in the stadium, unfortunately.
Mhm.
And we know from watching the NBA finals recently, and as such that really this comes down to testing and and very close monitoring, and the fact that every athlete and everyone there that is allowed access to the venues are being tested means the likelihood of having somebody that's infected unknowingly spreading the disease is almost zero compared to, say, when you walk, down the Third Street Promenade here in Santa Monica. You just don't know. So I would actually say that it's probably a safer venue there than in the general public.
Okay, that's good to know. Good, good. I appreciate your opinion about that. Now, speaking of Japan, how is the progress rollout of vaccinations in other countries?
So that's really the challenge. It's a classic story of have and have nots. You have the industrialized nations that are doing a much better job of vaccinating their uh, public and their citizens versus the third world countries. Indonesia has had an explosion of cases. Uh, what people don't realize is it's a country of over 150 million people, and their ability to vaccinate has been much less than we have had in the United States. Ironically, countries like Korea have been slow to vaccinate, partially because when the whole pandemic started, Korea was lauded because they were the first to really take testing and contact tracing very seriously. They became sort of the model for which other countries were trying to aspire to. What happened was that one of the biotech companies there had promised that they would have a vaccine ready, and Korea sort of believed them and put all their eggs in that basket. And unfortunately, that company was never able to deliver the vaccine at nearly the speed that Moderna and Pfizer and J&J have. And as a result, they hadn't been able to start vaccinating their public. So a lot of people from Korea have actually been flying to the United States to get vaccinated. Um, Japan is doing a pretty good job. China had their own Sinovac that they developed internally, for which so far the results don't seem to be as effective as some of the other vaccines. But if you really look at sort of Southeast Asia, um, Vietnam has closed their borders. Singapore has made it very difficult for people to travel in and out because when you don't have the ability yet to vaccinate your entire population, you rely on the not letting anyone in or out to reduce the risk of getting a virus in your community. So it's still a work in progress, and unfortunately, the majority of our world still remains unvaccinated. And as this virus, we know, goes to every single continent, those countries that have not had a chance to vaccinate, it allows the virus to not only infect their individuals, but to continuously mutate. So that it's not inconceivable that in the next 6 months to a year, we could have other new variants emerge that could then come back to the U.S. and wreak some havoc. So when people talk about a more equitable vaccination system to make sure that not only the most industrialized nations, but the poorest nations all can equally vaccinate, it's really because how important it is that we get everyone vaccinated so we reduce the potential to have pockets of populations in the world that can be petri dishes to allow the virus to mutate.
And speaking of vaccinations, a lot of people are hesitant to get vaccinated because the FDA hasn't really approved the vaccines yet. Do you have any estimation on timeline as far as when that will all be approved?
Well, I've heard that several of the makers have already applied to both the EU as well as the US FDA to approve the vaccines. And from what I've heard, even J&J is been submitted an application. And I think that will eliminate one of the excuses that people make about not
Hmm.
getting the vaccine. But now when you've had nearly, over 100 and nearly 150 million people vaccinated in the United States. I don't know what other treatment that is sold or approved in the United States has ever treated so many people. Um, uh, so we have more than enough data. Again, I think the reluctance for people not getting the shot at this point is all an excuse, whether it's ideological, whether it's kind of like not allowing your kids to get vaccinated. People are coming up with reasons, but I don't think it's rooted in any facts based with regard to the current vaccines that are being used.
So I myself currently have an 8-year-old and a 7-year-old little girls, and I'm ready for them to get vaccinated. I'm just sitting here waiting. Do you know of an estimated time where they will get their opportunity to be vaccinated?
Great question. So we know that the FDA approved the emergency use authorization for 12-year-olds and over. And right now, there are some studies going on with younger kids. My kids are very similar to your kids in age, and I too am anxious for them to get the vaccine. Uh, from what I've heard, they're hoping to have some data by maybe this fall,
Okay.
which late fall, which will be after school starts, but at least we can begin the process. One thing I would say as a parent is that we saw an uptick in the last several months, not of COVID in kids, but of other respiratory viruses like respiratory syncytial virus, uh, croup, the flu, because kids had been, again, they were basically quarantined at home, no social interaction. When things started to open up, they went back out and a lot of them were not exposed to COVID, but a lot of kids got sick. My own 5-year-old got sick and I had to take her immediately for a COVID test. She turned out to be COVID negative. But that's one of the things that I think parents have to deal with nightmares right now of their kids getting sick and immediately having to assume it's COVID, trying to scramble to go find a COVID test for their young kid, and then finding out it's not. But you know, let's not forget that pre-COVID, our kids were still very susceptible to colds through preschool or through their elementary schools, just by nature of how infectious kids are.
I was just actually going to ask you that question because now going into the fall, as you mentioned, schools are going to go back into session here in San Diego, where I live in northern part of San Diego. The school board has decided to bring the kids back full time. And part of me knows that, yes, as my kids, I always allowed my kids, I never really overprotected them. I always allowed them to be around people because I wanted them to get sick so they can build that immunity. As a parent who's fearful of that, what would you suggest to them as far as the new school year coming up?
Well, I think again, this is a work in progress, and having two young kids, I share a lot of your concerns. My 7-year-old went back to, I'm sorry, my 8-year-old went back to school. I would think it was like January of, no, no, later than that of last year, full time. They
Mhm.
tested the kids weekly. They had to wear masks. From what
Right.
I see right now, LAUSD has mandated that all the kids are going to have to wear masks this year, um, uh, indefinitely for in-person learning. And I think as long as the kids are masking, as long as there are some good filtration systems, air filtration systems installed in the schools as part of the stimulus money. I know a lot of schools got lots of money to be able to do that. And as long as they practice good social distancing, keeping desks somewhat spread apart, I do think the infection rate is very, very low, but not zero. There definitely have been more kids that have been infected, particularly over the last 4 or 5 months. But I do think that going to in-person school, we've shown that it can be done safely, and I still believe that.
Awesome. No, that's good. That makes me a lot more relieved as a parent to hear that information. So, no, I appreciate you talking about that. Now, obviously, there's a huge divide between those that are vaccinated and those anti-vaxxers, and the information out there is fact and fiction. You just kind of sometimes don't know what to believe. As a professional, what are your thoughts about those people who refuse to believe in the science and facts of the vaccinations?
Oh, it's really sad. Last I saw, there are approximately 39% of all adults in the United States remain unvaccinated, and
Wow.
half of them say no matter what, they will not get vaccinated. But the other half said that if they are required to do so, they would. So you're starting to see that. You're starting to see, like in the state of California, they've said any state employee, if they want to keep their job, they're going to have to get vaccinated. Even in the NFL, you saw them pass a policy. If you want to play this year or coach this
Hmm.
year, if you don't get vaccinated, you're not going to be there. And the Minnesota Vikings just let go a coach because he refused to get vaccinated. I think that's what it's going to come down to is we're going to be required to do that in order to return to school. Very much like the way certain schools would not let kids return if they didn't have their measles shot. I think
Right.
that's what's going to eventually end up happening with regard to the vaccine. Now, ironically, you had a lot of people. There was an ideological divide along party lines nationwide. 86% of Democrats have had at least one shot, compared to only 52% of Republicans. But you're seeing a sea change because you just saw the governor of Alabama yesterday blast those people that had not gotten a shot as being selfish and as the biggest cause of why we're seeing infections in the state of Alabama. You saw Sarah Huckabee Sanders, who was President Trump's spokesperson, come out today, post a tweet saying that she was grateful to get the Trump vaccine. My feeling is call it whatever you want, but if that's going to help people get the vaccine, then I'm all in favor of it. The problem also is that um, I think if you can remove sort of uh, partisan aspect of COVID, which unfortunately has been around for so long, I do think that you can start to get more people vaccinated. And now you're starting to see more and more Republicans and conservative voices speak out. Even Sean Hannity the other day on his show said that everyone should get vaccinated. So I do think that this is really, really important.
No, I agree with you. I've been reading articles and seeing articles of people, especially young people, as you mentioned, those that feel like they're the warriors and they can fight through it all, are now in hospitals and having COVID and saying, "Can I get the vaccination?" And a lot of these articles are saying doctors saying it's too late, like, and it's scaring a lot of these people to get the vaccination. And in my mind, it's you're right. It's whatever you need to do to kind of tell these people it's important to get vaccinated.
Absolutely. And I will say it's never too late. As long as you've never gotten the infection, then it's never too late for you to get the vaccine.
Okay, so once you do get infected, it is too late.
No, not at all. I will say this.
Oh,
So in full disclosure, I was infected last November, um, and then I actually got the vaccine in March. But what I was saying is, for those people that up to this date have refused the vaccine and think it's too late, I would say no, no, no. It's um, it's still time to prevent you from getting the infection if you get the vaccine. So that's what I meant by that.
okay, gotcha, gotcha. And actually, I'm glad you brought that up because I have a friend of mine who actually watches my daughters, and she back in I want to say January ended up getting COVID, and she is a little confused because originally they told her, well, within you're kind of not susceptible 3 months afterwards or six. What's the actual facts about that? If you've actually received, gotten COVID, how long are you able to wait, or how long should you wait before you get vaccinated?
Um, I would say that again, this is still a work in progress, but from what I've seen, most people believe that if you were infected with COVID, that at least for the next 6 to 8 months, you're very unlikely to get infected. There are some people that believe that your T cells, which are part of your immune system that fights viral infections, will have memory beyond that. But I do think that after 6 to 8 months, there is a likelihood that you could lose some of that protection. Now, there is some data to show that if you've had a viral infection and then get the vaccine, that you're probably the best scenario of being the most protected moving forward.
Okay, that's good information to know. And lastly, I would like to, ask you your opinion as far as fellow healthcare workers who are again finding themselves back in the front line, battling COVID. What would you, say to those folks as far as just trying to get them through this new variant?
Well, I would say thank you so much for your service. I know it's got to be frustrating to take care of these people, particularly those that are deniers, that are putting you at risk, you and your families at risk. But that's why many of us have become healthcare providers, and just to how grateful we are for their continuous selfless attitudes and sacrifices.
No, absolutely. I appreciate you saying that. And Dr. Song, if people want to get the latest information about COVID and the variants and all of that information, what's the best advice or website or social media that they should follow to get that most up to date information?
I think the best is the CDC website now. Under Director Walensky, they are rolling out a lot of daily updates, very accessible data, and I think it's data that people can trust. So that's where I would really go to right now, because that's really what's dictating a lot of the state policies and local government policies.
Perfect. Well, you know what? Thank you again for joining us for this, for the updated information about COVID. I do appreciate your time and you just, being here and informing us of the facts. And hopefully, as much as I enjoyed having you on the show, hopefully we won't have you back with another surge or another situation. But again, thank you so much for joining the show today.
Always great to be on, and thanks so much for getting the message out.
Absolutely. And to learn more about today's show, please visit us at AsianVoicesRadio.com. Also, be sure to subscribe as well as follow us on Facebook, Twitter, and Instagram. And until next week, I'm Hula Ramos. And on behalf of my guest, Dr. Paul Song, we'd like to thank you for listening. And please join us next week for another exciting and thought-provoking Asian Voices radio show. Take care until next time, everyone.